Psychiatrists insist that a mental health screening would be beneficial for everyone. But is this true? And what are the risks? In 2003, a presidential advisory group known as the New Freedom Commission on Mental Health issued a comprehensive program that laid out its strategy for screening major segments of American society for signs of mental illness. Some of their goals included programs creating early detection of mental illness, enlarging the role of schools in diagnosing and treating mental problems, and expanding the use of mental health screening beyond the psychiatrist's couch and into the offices of primary care physicians.
It's going to screen the population for mental health, the whole population. They're going to do it by stages, starting with school children, of course.
So far, mandatory mental health screening is not yet a reality, except for a few small segments of society. One of them consists of the most powerless and disenfranchised of them all, foster children.
A child goes into foster care. They label the child with some kind of a psychological problem. The child is immediately sent to therapy. Well, the therapist will say, well, I believe the child needs to be on something. So they recommend that the child see a psychiatrist to have the drug administered.
Out of the 60, 65 families that I see, easily 90% of the kids they have the mental health diagnosis to begin with. If they get it from a psychiatrist, it almost always comes with meds. And I think that we see identified as at-risk kids in the community, and we see some of the most intense situations. And a lot of them are on 4 or 5 different meds.
I've seen children that when the day they're taken out of their parents' custody and placed into state custody, actually seem happy, healthy, vibrant, energetic. And then, 2 months later, after they've begun taking these medications, they are very slow. They are zombie-like, is the best way to describe it.
Today, all children entering Texas's foster care system receive mental health screening. The result? 60% of the state's foster child population is diagnosed and put on at least one psychotropic drug, including some children as young as 3 years old. And it is worse in other states. In Massachusetts, for example, 2/3 of children in state care are being treated for mental illness. Nationally, foster children are being drugged at over triple the rate of children in the general population, such as in the case of 7-year-old foster child Gabriel Myers, on 2 powerful psychotropic drugs, one carrying an FDA warning for causing suicidal thoughts in children when he hanged himself with a shower hose. Another market segment is active duty soldiers, who are routinely screened at military clinics, labeled with a mental disorder, and given powerful and potentially violence-inducing drugs.
Iraq wasn't like Vietnam. There weren't illegal drugs everywhere. But there were drugs everywhere because, every guy on post, they knew all they needed to do was go down and see the combat stress unit, the shrink, and he was the drug dealer on post for us.
Almost everybody that saw the body or experienced the event were put on some sort of psychotropic medication.
Some bases where my friends were at, my fellow veterans were at, everyone, the whole platoon was on drugs.
I would say about 75% of active duty military is addicted to some type of psychotropic drug.
You can walk around a military barracks and you ask someone for some Prozac and somebody's got some Prozac or some Xanax or some Zoloft.
I've got friends who were in the Army with me who are now dependent on Zoloft and psychotropic drugs just because they got used to it in Iraq and they didn't ever want to get off it, and now they're dependent on it and addicted to it.
We have huge numbers of military people on antidepressants, and instead of the suicide rate going down, which you'd expect if the drugs were effective, the suicide rate is going up.
This last January, we had more soldiers commit suicide than we had die in combat. And what's not being brought out much yet is the fact that the large majority of these soldiers were on these drugs. We're drugging the military at a rate we've never, ever seen before.
And this is just the beginning. Military mental health screening programs are planned for 43 clinics in 15 bases throughout the United States, Germany, and Italy. Studies reveal that as many as 12% of those serving in Iraq and 17% in Afghanistan are on some type of antidepressant or sleeping pill. A total of 20,000 service members. But this number pales in comparison to the number of pregnant or postnatal women that could be drugged should mandatory psychiatric screening laws for them come to pass.
And when a woman is pregnant, right during the pregnancy, specifically right afterwards, her hormones are changing and sometimes raging. And to screen them and call it mental illness, if they have any type of emotional issues in any way, shape, or form, is utterly ludicrous.
Even without laws mandating it, expectant mothers may be screened for mental illness and not even know it. Here are some women interviewed coming out of their doctor's offices.
Have you ever been screened for mental illness?
I have not been screened for mental illness.
No, I've never been screened for any mental illness.
I don't remember any pre-screening. I have not been.
No.
No? Have you ever been screened for any mental illness?
No, I have not been screened for any mental illness.
Did your OB/GYN or gynecologist have you fill out a questionnaire that contains psychological questions?
Yes, my OB/GYN did give me a questionnaire that has psychological questions.
I've never been screened for mental illness. Yes, I would say the first time I went to see my OB/GYN, I did fill out questionnaires about even family medical history, my medical history, my mental state.
I've not been screened for any mental illness or depression. I took a questionnaire at my 6-week checkup, and it basically asked me about if I was crying, if I felt depressed.
Yeah, it was a questionnaire about depression. If you're depressed, or if you had any history of depression.
Are you happy with your normal day? Are you happy about being pregnant?
Have you ever hurt yourself? Are you happy? If I feel like hurting someone, if I was angry.
Do mental illness run in your family?
You know, it was very noticeable to me after the pregnancy that they're actually fishing for the postpartum depression.
When I was pregnant with my daughter, before I had her, I had to take postpartum depression medicine from my 7th month on to my 9th month.
And where is this screening leading? To programs like a little-known drugging scheme originally formulated in Texas in 1995 called the Texas Medication Algorithm Project, or TMAP.
TMAP is a program that was originated starting in the 90s, a collaborative group of doctors from University of Texas and the Texas Department of Mental Health and Mental Retardation. And what it was supposed to do was come up with the best practice for treating mental illness.
Using research funding from 11 different pharmaceutical companies, this panel, dominated by psychiatrists, created a step-by-step flowchart that requires the prescribing of only the latest and most expensive psychiatric drugs for patients with mental problems. And if one psychotropic didn't work, doctors were obligated to try another expensive one. And if none worked, the next step would be electric shock treatment. But those running TMAP were hiding a major conflict of interest.
They didn't disclose that the researchers that were all involved in creating this, almost every single one of them had financial relationships with the pharmaceutical companies.
But Texas isn't the only state with problems of corruption. Alan Jones was an investigator in the office of the Pennsylvania Inspector General.
I learned that these monies were all coming in to the state to support and to promote a program called TMAP, the Texas Medication Algorithm Project. And so my concern was piqued very quickly that there was at least one state official who might be inappropriately receiving and dispersing monies from drug companies. They called it PenMap, but it was based entirely on the TMAP model. Also very quickly, I learned that there were other state employees who were serving on advisory boards financed through various pharmaceutical companies, and other state employees who were accepting honorariums personally, directly, from drug companies for speaking in their state capacities or official capacities. That's a felony in Pennsylvania. I saw there was a much bigger picture and attempted to surface that bigger picture and was consistently told to back off. I was told that drug companies write checks to politicians on both sides of the aisle. back off. You will not expand this investigation into the drug companies. Continue to press the investigation, much of it on my own time at this point. I became increasingly alarmed that all of the drugs recommended by the TMAP program were exclusively the new patented atypical antipsychotics for schizophrenia and all of the brand new patented SSRI antidepressants. None of it added up. When it became obvious to me that my investigation was not going to be permitted to continue, and it became obvious to the Inspector General's office that I was not going to stop, I was removed from lead investigator on the case. They threatened me with loss of career, with loss of job, with loss of reputation, essentially.
Despite the investigation resulting in the conviction of Pennsylvania's chief pharmacist, TMAP and offshoots like PenMap spread throughout the country, generating billions of dollars in drug sales. But the psychiatric gravy train comes at great public cost. In 2001, TMAP and its children's equivalent CMAP bankrupted the Texas Medicaid program and the state's mental health and prison systems. So, what do we see in the final picture? A government-run, taxpayer-funded mental health screening program wherein every person judged by psychiatrists to have a mental illness is given powerful, dangerous, and expensive psychotropic drugs. And if they don't work, electroshock treatment.
They're going to start with school children on the New Freedom Initiative. Then they're going to move it to senior citizen nursing homes. Then they're going to move it to, of course, military. And then parents.
By the time you're 18, you've been screened in utero when you were an infant. You were screened as an infant when you first came out. You were screened in your daycare. You were screened then at school. You were screened at the pediatrician's office. You're screened in high school. You're screened over and over again.
And to sit there and pass laws requiring that people be screened and drugged based on screening under state law or federal law is really, it's criminal. It should not be done.
They're marketing this madness all over this country, and we are actually becoming an example for the rest of the world. So we're, again, the poster child, if you will, and so the rest of the world is spending more and more on drugs.
I don't know that there was ever a time in the history of the world where people have been drugged to the extent of what we're seeing today.
The reality is, if you look at the overall picture, I don't see these drugs helping us make a better society. We see it in the military, we see it in our children, we see it in the schools. These drugs are not working to make a better society.
And with hidden mental illness marketing campaigns at full tilt, what happens to patients once diagnosed and delivered into the psychotropic drugging machine?